Do you want to be around for your family? Do you want to be around for your kids? Do you want to be able to walk your daughter down the aisle? I have heard that from many, many men many times when they come into the practice and they're scared, essentially, about their mortality. Now, guys, plain and simple, cardiovascular disease is the #1 killer of both men and women. Cardiovascular disease is extremely prevalent in the United States, and we know this. You guys may have heard of something called the widowmaker. So the widowmaker is essentially a heart attack that kills you almost pretty much instantaneous. The reason this is called the widowmaker is because of just that. Whenever you get this heart attack in the particular artery, it's called the LAD, the left anterior descending artery. So we didn't go into too many details about that, but essentially it's one of the main arteries that supplies the blood to your heart muscle. So they call it the widowmaker because whenever you do get a heart attack in this area, it's going to almost be a certain death for most men. So what do we do, guys? How do we prevent this from happening, right? You get screening. If you are one of our patients, you are in the right place. Oftentimes, cardiovascular screening is done, but it's not done what I feel to be deep enough. There's a lot of additional testing you can do that goes above and beyond a basic kind of general wellness exam with your physician. After practicing medicine for over 14 years and working specifically with men, we have picked up on multiple things we can do that are easy, simple, that can help to increase our knowledge about what's happening within the blood vessels of your heart. And I've discovered time and time again that most physicians are not doing this routinely. Now, this is no fault to anyone. I'm not trying to point fingers or anything. This is kind of the way our system is currently set up. We have certain standards and physicians are following the standards, but I believe that the standards are not good enough to help save more lives. So at the Phoenix Men's Health Center, when you guys are working with us, right, you know that we're going to help direct you in the right way. So what are some things you can be doing? Well, one, whenever you go see your physician, you can ask for more extensive heart exams. And when one of those can be some blood work. You have your cholesterol levels, right, that you test for. There's also other things you can test for inflammation, particularly in the heart. You can also test for inflammation in the body. And you can also test for inflammation associated with different types of diseases. The cool thing about that is that we know as inflammation as a whole in the body is going to lead to more health problems, but in particular, inflammation in your heart. Within your lipid panel, your cholesterol panel, there's additional testing you guys can do. For example, one's called LPA, other one LP-PLA2, and ApoB. These are 3 simple blood works, a simple check mark on the lab order sheet that will help to give you more information about your heart. So these are something else that we do routinely here at the Phoenix Men's Health Center. There's some basic imaging you can do too. One thing that we like to do is called the calcium CT score. Now, the calcium CT score is going to give us some data about what's going on with the calcification of the arteries within your heart. So what we do, physical exam, heart and lungs, blood pressure should be done routinely, along with some extensive blood work, along with some basic imaging. We start to put these pieces together, lifestyle factors, smoking, drinking, obesity, etc., family history. We put this together to help give you guys and us some good information to figure out, should we be taking this even further? So basically what we want to do, guys, is you're going to take this data, you're going to share it with your doctor, you're going to ask them for a little bit more in-depth cardiovascular screening. I always tell my guys, if you're at all questioning, is my heart okay? Please bring it up. Please talk to your doctor about it, guys. Because remember, this is important. Your lives are important. Your family is important. Your relationships with your family is one of the best things we have. We have our health and we have our family and we have time. And we want to get the best out of all of those. All right? So let's take these pieces together, live a long, healthy life. We are here for you guys. We are care for you guys. And we promise to give you the best healthcare possible.